care coordinators and nurses and doctors and psychiatrists. Sometimes you just don't want to talk to them about things that are going on in your life.
People find it easier to open up and trust someone who they feel there's a kind of equality of status, they've had similar experiences to.
The key is to be talking to somebody who's walked that journey themselves and know that they've come through it.
You can't speak to people who don't understand what you're going through. You've got to talk to people who experience similar, not the same, but similar kind of illnesses like yourself.
Now, a peer group could be a group of people with mental health problems all sitting around together, but we've had that for years and years. Origami groups and occupational therapy type groups and services, giving people something to do. What we're trying to get at here is something which is much more recovery focused. It's much more about helping people to recover their life.
I don't decry medication at all. I think it's very helpful, but it doesn't help with your relationship concerns and your inability to get a job or not being able to manage on the finances that you've currently got. And those things can escalate until people become very poorly. If people are diverted from a GP to a service in the community that can help you with all of these things, it means that you're managing without medication, and that's really very good. It can be very helpful to find a social solution rather than a medical solution.
In every other walk of life, we seek out support from our friends and our relationships to get anything done, anything difficult in life done, for moral support, emotional support. The NHS is a long way behind on this. It treats people very much as isolated individuals, and I think that it's missing a trick.
Peer support has a big role to play in the future mental health services. It can be used in an sort of almost infinite kind of amount of varieties. You can have peer support in so many different parts of the journey of someone's mental health. Solidarity in a Crisis is a peer support service with a twist. We provide crisis support for people who are in crisis out of hours on the weekend in Lambeth.
We have currently 8 actively working peer supporters. They are on call every weekend. They have mobile phones with them, so the public can actually contact them directly on their phones and talk to them really for informal sort of emotional and social support over the weekend. And there's also opportunities to meet people in the community for a cup of tea or a coffee, again as a way of supporting them further if they are in distress.
You can have so many different types of support. You can have more formal one-on-one support, which is talking about the issues that they're facing, or it could be a more informal one, which could be a reading group or like a knitting group.
What you're doing is you're generating a network, a supportive network within that community of people who have something in common, and it might be, for example, here in Stockport we have the knitting group, which began with a small number of people who were really interested in knitting, who wanted to give something back and set up a group, and it's now expanding to a number of locations in Stockport and it's hugely popular. The key for me is that knitting group isn't located in a day centre or a day hospital or a voluntary sector building in the mental health service land. It's located in those community centres and community buildings throughout Stockport, so that it's not labelled or stigmatised as being a mental health service, but it's actually a people service.
Crafty Needles is a group where people come and socialise, chat, have a drink and do knitting.
People have time here. You can sit and talk for 3 hours, 4 hours, and you can't do that at GPs.
I was diagnosed with depression, which made me suicidal about 15 years ago, and I was really, really ill. I went to the doctors and I asked for help, and he suggested me seeing a counsellor, which I did. But I remember coming out of there and just crying my eyes out because I felt I wasn't helped in any way. My daughter had seen the Wellbeing Centre and said, "Mum, why don't you try that?" So I came down and I haven't looked back since. The changes I see in people are absolutely incredible. They come in either not speaking to anybody, sitting on their own, not talking to anybody, and week by week you actually see them beginning to talk to other people. They start making friends. They haven't knitted before, they enjoy it because they feel that they're part of a group.
We're in the age of austerity. We've got significant restrictions on our budgets. We're going to have to do things very differently. Let's make our systems more efficient. Let's tap that resource of peers that we have who are only too willing to help, because it actually helps our own recovery as well. So it's a win-win situation.
Most importantly, you're given support by someone who has experienced the system themselves and knows what it's like.
If peer support groups were well resourced and supported, they could develop and become bigger and offer more opportunities to people.
Coming to somewhere like this and joining in and helping and socialising can lift anybody's spirits.
It's been a godsend in a way.